Mounjaro, Tirzepatide, is a prescription medication used along with diet and exercise to improve blood sugar, glucose, in adults with type 2 diabetes mellitus. It is a once-weekly injectable medication that works by acting like two hormones released by your gut after you eat: glucagon-like peptide 1, GLP-1, and glucose-dependent insulinotropic polypeptide, GIP. Mounjaro is indicated for the treatment of adults with type 2 diabetes mellitus. As an adjunct to diet and exercise to improve glycemic control in adults with inadequate glycemic control with metformin and/or sulfonylurea, with or without pioglitazone. As an adjunct to diet and exercise to improve glycemic control in adults with inadequate glycemic control with metformin and/or a GLP-1 receptor agonist, with or without sulfonylurea or pioglitazone. As monotherapy in adults with inadequate glycemic control with diet and exercise, who are not currently taking metformin or a GLP-1 receptor agonist. Mechanism of action: Mounjaro is a dual GLP-1 and GIP receptor agonist. GLP-1 and GIP are hormones that are released by the gut after eating. They help to regulate blood sugar by increasing insulin secretion from the pancreas, slowing down the emptying of the stomach, reducing appetite. Dosage and administration: Mounjaro is administered as a subcutaneous injection once weekly. The initial dose is 2.5 milligrams. The dose can be increased to 5 milligrams after 4 weeks. The dose can be increased 2.5 milligrams after every 4 weeks, if needed. The maximum dose is 15 milligrams. Adverse effects: the most common adverse effects of Mounjaro are nausea, diarrhea, decreased appetite, vomiting, constipation, dyspepsia, abdominal pain. Other adverse effects that may occur include headache, upper respiratory tract infection, back pain, hypoglycemia, gallbladder disease, acute pancreatitis. Mounjaro is contraindicated in patients with acute pancreatitis or a history of pancreatitis, severe gastrointestinal disease, diabetic retinopathy requiring acute therapy, proliferative diabetic retinopathy, or diabetic macular edema. Pregnancy or lactation. How long does it take to improve blood glucose control? Mounjaro can start to improve blood glucose control within 2 weeks of starting treatment. The full effect of Mounjaro may take up to 12 weeks to be seen. The most common adverse effects of Mounjaro can be managed by taking the medication with food, drinking plenty of fluids, and avoiding eating fatty or high-fiber foods. If nausea or vomiting is severe, the dose of Mounjaro may need to be reduced or the medication may need to be discontinued. Mounjaro is a new and effective medication for the treatment of type 2 diabetes mellitus. It is important to weigh the benefits and risks of Mounjaro before starting treatment. If you are considering Mounjaro, talk to your doctor about the best treatment option for you.